Hi, my name is Kelsey and today I'm going to be talking about the herbal craze. So if you haven't heard about herbs, today you're going to learn a lot about them. Specifically, I'm going to be talking about how garlic affects your patient's blood pressure or a patient with cardiovascular disease. How do we know if herbs are helping or hurting our patients? And what can we do about it? Well, first, in order to understand how herbal medicine works, I need to differentiate between herbal medicine and herbs. Herbs are part of a plant or a plant used for therapeutic uses. For example, I don't have any current medical conditions, yet I drink an absurd amount of tea. If I am struggling to fall asleep, I will drink sleepy time tea to help me fall asleep. I am using the tea for therapeutic use of sleep and not as a way to treat a condition in an alternative way. Patients that are using garlic are not using it for the just the flavoring or that kind of thing, but the patients are actually using the herbs so that they can lower their blood pressure. Herbal medicine is defined as the science of using herbs for promoting health and preventing and treating illness. Right now, if you go to the doctor, though, most people go to what we call Western medicine, and you expect the doctor to solve whatever is wrong with you. So you go into the doctor and you expect to probably get a prescription to help with your disease or whatever is going on. This is relatively new and has been developed in the last 100 years, but for thousands of years, people have been using herbal medicine to treat different disease processes. Garlic is something that has really boomed back into our culture. A lot of people are using alternative medicines, and it really has been a new thing in the last 3 to 5 years. A lot of people are searching the web, trying to find out other natural ways to help their body heal. And so garlic is one of those new things that has kind of emerged. Like I said, it has been used for thousands of years, but it's just now starting to get in-depth research done on it. And there's a ton of articles published in the last couple of years on the effects of garlic and blood pressure. 75% of the population still is relying on herbal medicines or alternative medicines for their treatment of disease. Now I'm going to explain how herbals play a role in cardiovascular disease. So when I keep saying cardiovascular disease, I'm basically talking about heart disease. So anything, a condition of the heart, like heart failure or that kind of thing. So normally we would prescribe our patient numerous medications to help decrease the amount of work that the heart has to do to pump the blood out. And a lot of patients run into the problem of not being able to afford their medication. So they will read on the internet or hear from somebody that, hey, I'm taking this alternative medicine or I'm doing this alternative thing to help with the cardiovascular disease or my heart problems. So then they will start to do that. It's really important that we screen our patients and make sure that we say things like, hey, are you taking herbal medicines? And if they say no, maybe even expand on what herbal medicines or herbal medications are. So recently I went to the doctor and they asked me, are you taking any medications or herbs? And I said no. And I went home that night and realized that I drink tea like it is going out of style, and that would be considered herbal medicine. For cardiovascular disease, there are numerous different herbs that people believe help them. And when I say things that people believe help them, that means that there hasn't been scientific evidence to prove that they are working. Garlic is one thing that has been heavily investigated and is one of the few things that does have some scientific evidence for. Common things that people use for cardiovascular disease is flaxseed oil, milk thistle, grape seeds, green tea, hawthorn, garlic, soy, astragalus, Asian ginseng, and ginkgo biloba. All of these, there is limited or no evidence that it's actually working. Because herbal medicines don't have to go through FDA approval, they can be marketed without you really knowing what's in the product. So for example, you could go to Walmart and buy all sorts of herbal medicines, but they haven't gone through FDA approval, which means that they haven't been tested for the certain disease. So a herb can never say that the medication is actually treating something because they don't have that backup from the FDA. With an FDA-approved drug, we would know how it is working in the body physiologically and how it would help or hurt the patient cardiovascular because of the extensive testing done. A positive of herbal medicine or herbs that you can buy is that they don't have to go through this extensive testing, because that means A, they are cheaper, and B, they come a lot easier to the population. You have a lot more access to them, which is beneficial because A, you don't need a prescription, and B, it isn't going to cost you a lot of money. And so if you maybe can't afford your medicines, then you can get alternative medicine. Taking these herbs can harm you more than they can help you. And I would consult your doctor before you start any herbs, or if you are currently taking any, maybe just make a phone call to make sure that you're not hurting yourself or maybe putting yourself at a greater risk for a complication. So for example, a common alternative medicine that people take is called melatonin, and it helps you fall asleep at night, relaxes your body. The issue with this medication is that it's so easily available, and I'm not saying it's bad for you, but if you look at this picture here, there is a lot of flashy advertisement and you want to buy this product, so you might overuse it. Another thing is they have a little plus on it, and that little plus indicates that this medication or alternative medicine is not regulated by the FDA. 1 in 4 deaths are from cardiovascular disease, so it's pretty common in the United States. Examples of cardiovascular disease, again, would be like coronary artery disease or heart failure. And something that comes along with all of these is high blood pressure. So when a patient has high blood pressure, it makes your heart work a lot harder, and it's harder to get the blood going. So they're usually prescribed something that will lower their blood pressure. Garlic does that naturally. So if you take garlic along with a blood pressure medication, it's going to drop them even lower than normal. So garlic alone would drop you to a normal blood pressure level, or a blood pressure medication would drop you to normal. But if you take them both, it'll go below that normal into an unsafe level. So garlic also has other effects on your body. So it decreases the cholesterol, decreases triglyceride levels, it decreases blood pressure, like I already said, and then it also reduces the clotting capability of your blood, which can be good, because if we have our blood really thick, that means it can clot easier. So when the blood isn't able to clot as easy, we can decrease the risk of getting some sort of stroke from clot forming. Decreased cholesterol level is good. We don't want to have a lot of the buildup in the veins and arteries of a patient. Same with the triglyceride levels. It's all bad things for your veins and arteries. Some research has shown that garlic can reduce hypertension by as much as 7 or 8%, and even lowers blood pressure in people with normal blood pressure. Garlic has also been found to reduce the risk of atherosclerosis, which would be the narrowing of a vessel from the buildup of plaque in it. So garlic can also decrease your chance of that when we go back to our triglycerides and cholesterol. So this is what would build up in the vein or the artery, and then the garlic gets rid of that. Different types of medication that would be prescribed are warfarin or heparin, which are blood thinners and will decrease your blood clotting capabilities. Common medications used for high blood pressure are ACE inhibitors, diuretics, beta blockers, antihypertensive drugs, calcium channel blockers, and vasodilators. So if any of your patients are taking that medication, you're going to want to be cautious that they aren't also using a supplement of garlic. Ways that people supplement with garlic would be when they eat 1 to 4 cloves of fresh garlic a day, or when they actually take a pill of it. So with atherosclerosis, or the cholesterol and fat that builds up in your artery, it's very important that we decrease the buildups in the lining of your veins and arteries. One of the studies I looked at showed how garlic protects the arterial wall by decreasing the lipid content in the arteries. So it not only prevents, but it also treats the cholesterol and lipid buildup in arteries. So it is anti-atherogenic and anti-atherosclerotic. Garlic suppresses the hepatic activity of the enzymes that cause lipids and cholesterol to be made. Garlic also increases the excretion of cholesterol, and they were able to test that by testing the excretion of a patient after eating garlic. The compounds S-allylcysteine and diallyl disulfide are in garlic and are potent inhibitors of cholesterol synthesis. So that means they're actually stopping, again, the production of the lipid and cholesterol. Garlic also inhibits platelet aggregation. So when you think of our platelet aggregation cascade, we have all these different things going on that are causing a clot to form. And we do need clots, and clots are important when it's closing up like a wound or something, or a little hole in our artery. We want it to stop it because you don't want it to bleed internally. Garlic reduces the formation of thromboxanes, and it inhibits phospholipase activity and lipoxygenase production. These are all enzymes that are part of that clotting cascade, so it's blocking the clotting factors. There also is possibly a link to calcium. It can be blocking the release of calcium, and that keeps it from entering the platelet. Therefore, it acts on platelet aggregation at various stages involved in the process. So it's not only just like a platelet that's formed or it's going to thin your blood, but it acts on it at all stages. The takeaway message is that herbal medicine can be beneficial to someone struggling with a cardiovascular disease, but shouldn't be taken without your doctor knowing to avoid drug interactions. Also, you want to proceed with caution when you're taking these medications, because the limited testing means limited knowledge on the effects in your body of these herbs, even if you aren't taking a medication with it. We don't know if the product is actually working or not. So if you really have the choice, I would just call your doctor and make sure that you aren't taking something that you shouldn't be. And also when you go to the doctor, make sure to tell him or her what medications you are taking along with any herbs. A lot of these herbs are commonly used all the time. You don't even realize that you're using something that would be considered a herbal medicine, and garlic is something that we commonly throw into food, and that's very okay. It's when you're taking a large amount of that garlic for the intended purpose of reducing your cholesterol that you need to be careful, or for reducing your blood pressure. To see a full list of herbs, feel free to click the link at the end of this video, and it will take you to a list of common herbs used. Alright, well thanks for hanging in there. Hope you enjoyed my talk.